Being the 7th largest hospital in the state of Florida, Tallahassee Memorial serves the lifespan of all patients, from the NICU from birth all the way through end of life. One of the areas that we really focus on are outpatient services, such as neurological rehab.
We have a really great team, and we're pretty heavy in NDT techniques and lots of weight bearing, complementary e-stim when it's appropriate to help reactivate some muscle groups or bring more attention to an affected side.
We schedule anywhere from 1,500 to 1,600 patient visits every month.
I was so excited when we got the robotic arm because it meant we had an addition and enhancement to what we're already doing.
The robot has been highly utilized since arriving here just a few months ago. At first we thought it would just be our stroke survivors that would be using it, but I would say it's a rare day that I can come into the room where the robot is and it's not in use by a patient.
One of the things that the robotic arm does is it gives the patient repetition of movement, which is really difficult for a therapist to do 400 movements of an arm. So we're able with the arm to allow them to get 100, 300, 400 movements in one session without them being overly fatigued and of course the therapist being overly fatigued.
We'll spend about half of their treatment time using the robotic arm, and then we'll spend the other half of their treatment time applying that movement that we just worked with on the robotic arm. So we'll move from that into weight bearing, or we'll move from that into functional activities.
It's repetition, repetition, repetition to get muscles to work, to get the arm to move again. And this carries over with their driving. It's carrying over with them even driving their electric wheelchair. It's carrying over with their feeding. It's carrying over with all the functional activities that we do.
Some of the features for the data that we can gather allow us to print out in graphical format that you can attach with your notes, and doesn't take a whole lot of advanced skill or advanced medical knowledge to read. You're able to look at the circle graph and you're able to tell, hey, the circle's more rounded on this side. It looks like they're reaching further.
And there's nothing like a patient being able to see progress on a piece of paper. And looking at that screen and seeing where they were and where they are, it proves their progress. And so the biofeedback is an incredible positive component of the robotic arm system. Our patients realize fantastic outcomes through this clinic. And what I'm seeing in our patients is hope.
They told me I would never move anything, not even my neck. And as you can see, I'm moving my neck, I'm moving my hand, I can shrug my shoulders. So I mean, this machine is just giving me hope, basically.